Masks have come off in the US, and many Americans have already received a third vaccine dose. But in many countries, residents are still waiting on their first dose. Here's how the US plans to help.
Developing countries that haven't yet crossed sometimes even a 10% vaccination threshold, never mind getting to the objective that we have by the end of the year, which is 70%.
Part of the reason high-income countries received a majority of COVID vaccine doses. Public health experts have been warning of a rise in new variants and the inability to end the pandemic without a global vaccination plan.
We are not an island. There's no scenario where our economy can thrive without investing in ending the pandemic globally.
Since the start of the pandemic, the U.S. has pledged 1.2 billion doses for free to lower-income countries. President Biden has set the goal of getting at least 70% of the world population, that's more than 5 billion people, vaccinated by the fall of 2022. The UN and WHO wanted that goal to be met by the summer.
1.2 billion doses, that's what's been promised from the US. How many so far have been distributed?
We're over 400 million just from the US in terms of bilateral donation.
Part of the slow distribution, wealthy countries that developed the vaccines, like the US, are focused on inoculating their own citizens first, while making promises to donate vaccines that UN and global health groups have criticized as too low. By last fall, those same nations did not meet their promised donation targets.
We are hearing from very few countries now, we don't have enough vaccines. What we are hearing is we need support in moving from vaccines to vaccination, moving from vaccines on the tarmac and the delivery of those vaccines to actually getting those shots in arms.
So now it's a personnel problem?
Well, it's everything. It's everything. When you have zero supply and then you suddenly go to getting 2 million doses landing on your tarmac, it can be hard to put in place the machinery to get those shots in arms immediately. And so that is why we launched an initiative called Global Vax.
Global Vax launched last December to get more vaccines into arms, specifically targeting 11 African nations. Local health ministries helped chart that course, setting up locations and preparing for the vaccine, creating lines reminiscent of those witnessed across the U.S. last year. And that pipeline isn't new. It's been done for polio, measles, tuberculosis, among many other diseases. But vaccinating children at schools is a different task than an entire population.
The first lesson is don't reinvent the wheel if you don't have to. When we have a pre-existing polio vaccination program, let's try to tap those networks, the data entry systems, the basic infrastructure within health clinics. But the other lesson is you just have to be willing to adapt.
The US and other industrialized nations have been criticized for not moving fast enough to vaccinate lower income nations. I believe the UN secretary said it was immoral the way this rollout occurred.
We've of course heard those criticisms, understand those criticisms that countries would have liked those vaccines sooner, but now we have them. And we need to focus on this inflection point that we are at, which is our success.
And she says they've already seen success, even with the issues around transport and misinformation and vaccine hesitancy.
In the country of Ivory Coast, in sub-Saharan Africa, just by modest investments and by really concentrating resources, first dose vaccination rates going from 22% to 36% just in the month of December. We've seen in Zambia, we were able to increase full vaccination rates from 12 to 22% just in a few week period. And so we see that when the political will is there, when we're willing to meet our words with our resources and galvanize others to do the same and bringing those to communities, the hunger to put this pandemic behind us is a hunger that is universally shared.